Is this working? Yes. Hi, everyone. Hello. I'm Lori Sypher. I'm Vice President of Sales at Elsevier. And today we're focusing a bit on how data can help the future of healthcare professionals, specifically educating healthcare professionals. And I'm sure everyone in this room has heard of the lady with the lamp. The lady with the lamp is a name that's been given to Florence Nightingale over time. She lived in the mid-1800s. And she's known as the mother of modern-day nursing. The mother of modern-day nursing for many reasons. And she provided care with about 15 other individuals to troops during the war in England. And the Lady of the Lamp is an imagery of how she and the other caretakers worked with the soldiers. Now, what we don't know as much about Florence Nightingale is not only was she a nurse and helped with the modern practice of nursing, she was also a statistician. And she understood the need to gather and use data in order to make predictions and to tell a story. So when we look at, can you advance that slide for me? Thank you. When you look at this imagery, the first version of this was made with pencil and paper. And what it does, it's the information that she's gathered during the war. And you'll see that each wedge represents a month during the war. The red represents the deaths in the battlefield from wounds. The blue represents deaths of soldiers from preventable disease and infection while they're being treated. When we look at this, we see that sometimes data alone doesn't tell the story that needs to be told. So when she brought this back to Queen Victoria, she was able to help influence the practice of healthcare and start to really make a change in hygiene within healthcare facilities. This is no different than some of the challenges in healthcare today. And when we think about some of the practice in the United States, the third leading cause of death is from medical error. And this speaks to the need for great education, measurable education for nurses and healthcare professionals. Because that doesn't make the news alone that the third cause of death in America is medical errors. But if you imagine for a moment that 2.7 jumbo jets fell from the sky on US soil every day, that's how many people die from medical mistake in the United States. When we look at first-year nurses in practice, 40% of them report medication errors. 50% of them say they would not recognize the need for a life-threatening intervention. And for a first-year nurse, there's 30 to 65% turnover in the first year. There's a great need to make sure that as we work with healthcare professionals, there's education, and we're able to gather information and data. These statistics are from the National State Boards of Nursing. And one thing we can say is the population and Americans are living longer. However, living longer doesn't mean that we're living better. When we look at the baby boomer population, 1 out of every 4 baby boomer suffers from diabetes. 40% are obese, and half take medication for hypertension. This is significant, and it's changing the need and the supply in healthcare. Thank you. So when we think about the pressure to supply, healthcare employers are looking to higher education institutions to supply more healthcare professionals than ever before. Higher ed institutions need to acknowledge that there's a lot more patients from the baby boomers aging and the complexities within the healthcare system. Healthcare is changing. It's changing rapidly. When we think of more long-term care facilities, treatment and outpatient treatment, ambulatory care, in-home care, population health, the need to serve within the community, as well as a shift away from the hospital and how our providers are getting paid under the Affordable Health Care Act, which limits payment to patients over time. So, for example, if a patient has a heart surgery within a hospital facility and they return within 30 days, the hospital may not get paid for that secondary treatment if it was shown to be a cause of the surgery. The ACA is requiring providers to look and act differently, which is also having an effect on how we educate students and prepare healthcare workers to work in the health system. Demand is on the rise. When we look at all of the aspects of healthcare and the needs within the healthcare system, the supply and demand are both growing. You can switch it. Yeah, thanks. The Bureau of Labor Statistics is forecasting strong employment outlooks for healthcare professionals. In fact, when we look at the statistics, 50% of the fastest growing jobs will be coming from healthcare. 21 of the top 25 jobs will be in healthcare. 8 of the top 10 make up healthcare professions. There's a lot of growth and there's a lot of need. And when we look at registered nurses as an example, by 2022, we expect there will be 3.2 million jobs and 1 million vacancies. There's several sources that will estimate these supplies, but when we look at nurses as one role and then look at the other healthcare professionals that are needed in the hospitals and care facilities, what you'll see is there's a significant increase in demand for all levels of workers, especially as we look at how healthcare is changing from a provider aspect, from a payer aspect, from a patient aspect. There's a great need for individuals to take responsibility for their own healthcare, and that's driving healthcare into the home and into the community. Patient education is significantly important, and the way that patients will receive information is dramatically changing as well. How we educate students has to change, and we have to use data and analytics to predict their readiness to go into the care practice and to provide evidence-based care for us and our families. There's a lot at stake here. The age imbalance of the current workforce and the rate of retirement is also having an effect on the demand. When we look at baby boomers, they're also going to retire. There's a need for higher quality care. There's specialization, age imbalance, turnover, and geographic pressure. I was in a presentation yesterday, and they said that sometimes, we would look at the different life cycle, and most people would retire at 62. That's not happening now. People are staying in the workforce longer, but they need additional health care, and they need health care wherever they are. When you look at the need within an education program, what educators need to do is they need to attract interest early for students to understand what role they can play. They need to acknowledge today's student profile. There is a lot of information that nursing students and healthcare professionals need to learn. And they need to learn how to navigate through systems and understand concepts that will affect populations from birth through the lifelong practice of living and death. So technology needs to enhance that student remediation. So what programs are doing is they're looking at students and looking at students through a curriculum. So before they start the curriculum, where are their strengths and understanding strengths, but also how are they acquiring the knowledge and how are they thinking critically about what they've learned so that they can deliver better patient care. The focus of educational institutions is all about learning outcomes and what skills are successful in the workplace. There's both the cognitive skills and the non-cognitive skills that are important. Students need to know how to be professional, how to interact, how to demonstrate and have empathy for patients, and how to deliver the best care and ensure that when patients leave that care facility, they know what to do outside of that care facility, the hospital, the outpatient facility, or wherever they are. At Elsevier, we feel we have a credible vantage point to really address some of the issues in education. And who we are is 96% of the top 100 health systems and 76% of all health systems in the United States use some of our Elsevier's clinical solutions in practice. We need to bring that into education so students are learning on the same material and evidence-based practice that's used in the hospitals. We also have more than 25,000 products that are used in academic and government institutions across the world. And 20 million healthcare professionals are served by Elsevier each and every day. And how we do this is by providing clinical reference material in the hospital, risk analysis on patients, where we gather data and information on patients to help an institution understand the risk of that patient. We provide information to enable providers to prescribe the right information for treatment to their patients, whether that's education on disease or prescribing pharmaceuticals. We provide drug databases. We provide order plans, order sets, care plans that directly embed into the electronic medical records in practice. And when we look at education, we understand what students need to succeed. And when we look at the electronic products that are in use, we know that they have to be easy to use. They have to provide engaging content. They have to connect to students' current knowledge set and help them expand what they know, what they learn, and the decisions they can make when that information is served to them in the real world. We also know students respond well if they can see how they progress and there's interactivity in the products. And we need to provide remediation at the time that it's needed to students. So if they're having trouble with a concept, we know we have to deliver the information to loop back and teach them at that teachable moment where they're ready to learn and they have the ability to acquire that knowledge. We also know that when we're looking at a personalized digital program, the ecosystem has to work together. Faculty have to, and institutions have to be able to assign, assess, and teach from a single mobile optimized interface. Students have to be on a personalized path for learning. There is too much content and information in healthcare to focus on everything. We need to deliver content and learning to students when they need it, where they need it, and exactly what they need. We need to have the evidence-based data and analytics to measure the student engagement, their progress, and success through a program. And we all know that certification is the gateway to practice. Students in, whether it's a nursing program or other healthcare professional programs, they can't practice until they pass the certification exam. And certification exams are usually based on critical thinking and application level questions. So we have to empower students with the advanced data and analytics. And the way to do this, it's increasingly important to track students' progress through a curriculum. So understand where students are throughout a program and feed them the remediation that they need in order to excel, which will provide the building blocks so that when they're ready for certification, they have the confidence, the know-how, and they're able to pass exams and go directly into practice. We also recognize that instructional platforms are important as well. And at Elsevier, ours is called SurePath. And we've invested in interactive content that engages students, provides that looping repetition that's needed as students work and progress through the instructional platform. It measures student outcomes to motivate students and set them on their individualized path to learning. It also coordinates with what's happening in the classroom, so institutions and instructors can see where a full student body is excelling or where there's weaknesses potentially in instruction or curriculum. And then it also offers simulation that provides exposure to clinical settings and gives students an opportunity to practice critical thinking skills, making decisions, and working through real life scenarios with patients at no risk. This helps with the comfort when they do go into practice. So when we think about it, by 2040, nearly 22% of our population will be 65 years or older. This demographic will need a broad array of healthcare services and interventions. Integrating innovative new technologies into curriculum and programs, and by design to help with the practice of healthcare is important. We have a lot riding on this topic. Remember, the healthcare workers and nurses provide care not only to everyone in our society, but to us, to our family, to our parents, to our sisters, to our brothers, to our children. And we're very excited to work with you all to integrate new technologies and utilize the dynamic of gathering great data and analytics to provide insights into leading the charge and educating tomorrow's healthcare professionals today. Thank you.